8:14 Thursday morning, October 26th. Get turned cold by Halloween, which, man, I'm looking forward to. It's Medicare's annual enrollment period. If you want to change your Medicare coverage for 2024, now is the time to do so. And choosing the coverage that's right for you starts with learning the basics about Medicare. And with that, we welcome in Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, to take us through the ABCs of Medicare. Good morning, Doctor. How are you?
Hey, Tommy, I'm doing good. How about you?
Good. How are the dogs?
Doing okay. Having some potty training issues, but we're getting there.
Dr. B's got boxers, and we are both members of the Love Those Boxers clubs. Tell me about Medicare. How many parts are there?
Yeah, sure. So I know we've talked about this before, so this will be a good recap. There are actually 4 parts of Medicare. There's parts A, B, C, and D, so pretty simple. And each part helps pay for a different part of your healthcare services. And each one has certain costs that you may have to pay out of pocket. And those costs are going to really depend on things like how much money you've made, especially in the last couple of years, what coverage you choose, and then the individual healthcare services that you need to get.
Guess we may as well start with Part A. What does that cover?
Yeah, so Part A covers all of the inpatient hospital services. So it's really the insurance for hospital, and it covers the care not only in a hospital but also in a skilled nursing facility or even a hospice facility. And if you or your spouse paid Medicare taxes while you were working, you won't have to pay a monthly premium at all for Part A. But that doesn't mean that your coverage is totally free, because with original Medicare, you still have to pay a deductible for a lot of services. And so that's going to include things like inpatient hospitalization before the plan actually starts paying towards your care. But then after you meet the deductible, you'll also have to pay a copayment, or what's called a co-insurance, for any Part A services. And those specific costs are going to be determined by Medicare, and they do change from year to year.
What about Medicare Part B?
Yeah, so Part B is what we call medical insurance. So that's the insurance that's going to cover things like doctor's visits and preventative care, any of those outpatient services that Part A doesn't cover. And you can actually choose whether or not you want to enroll in Part B. But keep in mind that if you don't enroll when you're first eligible, which is usually when you turn 65, and if you don't have what they call creditable coverage from an employer, then you might get a late Part B enrollment penalty if you do decide you want to enroll later. And you'd have to pay that penalty every month for as long as you're enrolled in Part B. So that's why you have to really know, what the options are.
Yeah, you don't want to mess that up, I don't think. What do you pay for Part B, Doctor?
So people definitely pay a monthly premium for Part B, but it's going to be based on income, and it varies from person to person. So everybody pays a little bit something different. And then as with Part A, you also have to pay a deductible before original Medicare starts paying for your share of Part B cost. So after you meet that deductible, typically you're going to pay a 20% coinsurance for any of those covered services. But the good news is that most preventative care is going to be covered with no cost to the patient at all.
And that brings us to Medicare Part C.
Yeah, so Part C is actually things like Medicare Advantage plans, so things like those offered by People's Health. And while original Medicare is administered by the federal government, all of these Medicare Advantage plans are offered by private insurance companies that actually have a contract with Medicare to provide those benefits to you.
The difference between original Medicare and Medicare Advantage?
Yeah, so most people on Medicare begin with original Medicare. So that's going to include Parts A and B. And original Medicare covers most of the medically necessary services that you get in things we've been talking about, hospitals, doctors' offices, or other healthcare facilities. But it doesn't cover additional services, things like routine dental care, routine vision care, and it actually doesn't offer Part D prescription drug coverage either. And so that's why a lot of people choose to enroll in a Medicare Advantage plan. So the plans those plans have to cover all of the benefits that original Medicare covers, but then they offer a lot of extra benefits too. So things like dental, vision, hearing, they can include a fitness membership. They may also have a credit for over-the-counter health and wellness items. And then a lot of Medicare Advantage plans bundle the Part D prescription drug coverage as well, so you don't have to get a standalone plan.
All right, let me take a break. We'll pick it up here. We'll come back. We're going through the ABCs and D's, actually, of Medicare with Dr. Brent Wallis, Chief Medical Officer of People's Health. We're doing our best to explain it here on the air. I'll tell you, the easiest thing is to go to peopleshealth.com, or better yet, go to their center at 3017 Vets next to Party City, the People's Health Medicare Center. It's in Metairie. Appointments are recommended. Walk-ins are welcome. And nobody's going to hard sell you or hammer you, anything like that. They'll just explain to you what your options are, and it can be kind of difficult to understand. But we'll continue when we come back with Dr. Brent Wallis. It is 8:20. It's time for Traffic Now on WWL. 8:25, Tommy Tucker, WWL. Jordan Fiegel in studio. Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, paying attention, bringing us back with the Jackson 5 and ABC as we talk about the ABCs of Medicare. People's Health is a Medicare Advantage program, a 5-star Medicare Advantage program. The only one in the state, one of only 32 in the country, some pretty rarefied air. So I would ask you, do those extra benefits make Medicare Advantage plans more expensive than original Medicare?
Yeah, it's a good question, and really the answer is not necessarily. In fact, many of those extra benefits that you can get from a Medicare Advantage plan provide a lot of extra value. And a good example would be the dental benefit. So a routine dental cleaning, if you've gone and you've had to pay out of pocket, it's over $100. And if you just have original Medicare, which doesn't cover any dental services, then generally you're going to have to pay that entire amount. But if you enroll in a Medicare Advantage plan that's got a dental coverage benefit, then you won't have to pay that full amount. And a lot of times you don't have to pay anything because general cleanings may be included. And those savings really add up when you add in vision, dental, hearing. All of those can keep a lot of money in your pocket.
What about some other costs associated with Medicare Advantage?
Yeah, that's going to depend on the plan that you choose, and there's a lot of them out there. So some Medicare Advantage plans do have an annual deductible, so that's something you have to meet before all of the coverage kicks in. And they may even have a monthly plan premium that's in addition to that Medicare Part B premium that you have to pay every month. But there are a lot of plans, including most of the People's Health plans, that don't have any annual deductible, and they've actually got a $0 monthly premium. And so your other costs with Medicare Advantage are really going to be the cost-sharing amounts. So that's what you have to pay when you do obtain health services or prescription drugs. Usually people think of those as copays, and those are going to vary by plan. That's why it's so important to look at what all of those coverage amounts look like. But regardless of which plan you choose, in general, costs with a Medicare Advantage plan are typically lower than original Medicare. And one of the biggest reasons for that is because Medicare Advantage plans are required to limit your yearly out-of-pocket cost, while Medicare, original Medicare, does not put any ceiling on it. And what that means essentially is once you hit that yearly out-of-pocket cost, you don't pay anything else. But with Medicare, it can keep going. So if you need a lot of services, that's something to think about.
I get a text here that asks, if you enroll in Medicare Advantage, do you still have Medicare?
Yeah, you do. Yeah, you definitely still have Medicare. You have all the rights and protections that come with Medicare. Medicare Advantage is just really another way to get your coverage for those health care services.
Another text pops up. What is Medicare Part D?
Yeah, so Part D, which we kind of mentioned earlier, that D is for drugs. So it covers all of those outpatient prescription drugs that you might be taking. And the thing to remember about Part D is it's not a part of original Medicare. So you can only get it through a separate standalone prescription drug plan, or it can be bundled with your Medicare Advantage plan.
How can people find out more about Medicare and Medicare Advantage plans?
Yeah, I mean, like you mentioned, Tommy, this is so confusing, and I had to do this with my mom the other day. The best place to start is actually go to the Medicare website. Go to Medicare.gov, and you're going to find tons of information on there, educational materials, information about what's covered and what's not covered. But one of the greatest things is there's a tool on that website that lets you put in your zip code. You can put in the medications you're on, what coverage you're looking for, and it'll actually tell you all of the Medicare Advantage plans that are available in your area. So it's a good way to kind of compare what the options are available to you and make the best decision for yourself or for your loved one.
And tell us a little bit more about how people can find out about People's Health Plans and specifically the Medicare Center that we were at last week, because it really is a valuable resource.
Yeah, definitely. And I encourage people, that are confused about this. It is very confusing. Sometimes it's easier to sit down and just talk with someone about all of this. And so you can come in and see us anytime. We've got representatives that can talk to you in person at that Medicare Center, which is in Metairie. It's right at Veterans and next to Party City at Causeway. We encourage appointments so you can make sure you can sit down and talk to somebody right away, but walk-ins are welcome as well. So, come and see us. We're also hosting a lot of in-person benefits presentations, really in New Orleans, but actually all over Louisiana from now through December. So if you go to our website at peopleshealth.com/meetings, you'll see all of those presentations, and it'll give you a lot more information than we're able to talk about in a short segment. But it is really important this time of year to make those decisions that are best for you.
peopleshealth.com/Medicare Advantage to see what they're offering members in 2024. It's interesting, Doc, to hear you say that even with your mother, you had to go to Medicare.gov to explain it, because it can be confusing.
Extremely, and it's different in different areas, too. So everybody's got to do the research, myself included.
Good luck with the puppy and the potty training.
Thanks, Tommy. Talk to you soon.
All right. Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. We come back, we're going to talk to Alex Hammerstone, Director of Advisory Solutions for Trusted Sec. A number of sites, including Amazon, Expedia, and TripAdvisor, forming a coalition to tackle the problem of fake reviews. And that can work on two ways. It can be a place phonily reviewing, phonily? I guess phonily? Doing it phonily in a fake way? Reviewing themselves and giving themselves 5 stars, or the competition trashing them for no reason. A minute late, time now, WWL First News.